Just a friendly disclaimer before this video starts. If you hear a lot of noise, it's because my cats have chosen now to do the Macarena all over the house. Bye, kitty. Am I in focus here? Okay. So it's been 2 months since I had my surgery to get my lap band removed. If you don't know what I'm talking about, I had a lap band put in about 5 years ago and it was a complete disaster. I did other videos about it. I will link them down below, and I gotta stop talking too fast. I drank a lot of caffeine this morning. I've been meaning to do this video for a while, but for a person who has no life, I've been amazingly busy, and also just trying to recover from the surgery. This whole ordeal for me has been hard on me physically and emotionally. So since the surgery, I've had to kind of reevaluate a few things, and I'll let you know why, okay? Because we'll get into that. So I had the lap band removed at the Michel Gagné Clinic here in Montreal. It is a private clinic, and Dr. Gagné himself did the surgery. And I have nothing but good things to say about the doctor and about everybody at the clinic. I have very few complaints, which I'll get into. Just basically 2 small things that I thought that it could have been done better. But anyway, I digress. Overall, the majority of the main things were pretty darn great. So I went in September 17th in the morning, and I got there at 7:45, nice and early. We beat the downtown traffic, and well, I thought I would be getting in there, you know, and getting prepped for surgery, but no, we sat there and we waited and we waited. So this is my first complaint, I guess you can say. The clinic likes to get people in there several hours early. Like, they tell them a time several hours early because of people having a habit of being late, and they don't want to mess up their surgery operating schedule. And I can understand that, but for somebody like me who is always on time, like I'm obsessively on time or early, if not I stress out, it's kind of irritating that I had to sit around a few extra hours just in case somebody was late or whatever. Anyway, so they choose to do that. I understand why, but my nerves were shot because surgery is one of my biggest fears. So I'm sitting there kind of chewing on phalanges, waiting for the surgery to happen. When I got in there for surgery prep, I met with the nurse that I spoke to on the phone several days beforehand. She was very nice. Dr. Gagné came in and spoke to me again. The anesthesiologist came in and spoke to me again. Went through everything. I was taken into the surgery room. Everybody introduced themselves to me. All really nice, professional. I've never had that. I guess in the public system, everybody's just in a hurry. They're like, yeah, come on, hurry up, get on the table, we gotta go. On a side note, I know this is really kind of weird. It was probably one of the more comfortable operating tables I've been on. I know that may sound a little odd, but when I put my head back on the pillow, it was actually a nice height, and I didn't feel like I was choking or drowning or anything. It was great. But the surgery was about an hour long, and they were able to remove the lap band without any issues. Thankfully, there was no problems with it. It wasn't attached to my stomach. It didn't break down. There was no... So, which is great. I wanted to keep the lap band to show everybody, but it was sent to McGill Medical Center, so I guess some med student is torturing some cadaver with it right now. But I wanted to show everybody exactly what it was, so you could have more of a visual, but there you go, it's gone. So that's good. Everything was taken out, and I was stitched back up. One thing, though, one bad thing that they did find is I do have a fatty liver, which is not uncommon for overweight people. It does mean, though, that I really need to make sure that I use the benefit of this surgery to eat well and lose weight. And I have lost weight since surgery. I've lost 12 pounds Yay! I probably would have been more. I haven't been perfect. My birthday was in there, and I had some things that maybe I shouldn't have ate, but waffles, and not just any waffles. These waffles were anyway. So I haven't been perfect since the surgery. Yeah, I'll admit that, but I have lost some weight, and I have been overall, for the most part, eating so much better. So all the stress, all the money, everything, all the headaches, all the drama, it has been worth to get this done. It's been worth it. And, I had problems though coming out of anesthetic and waking up, so the doctor didn't like that very much. I mean, that's a sign that I'm not as healthy as I should be. So that made me a little depressed. What are the cats doing? 1 second. Here, go on. Here. That's not for you. Here. Again, they choose this time to do some line dancing. That's just life with cats, I guess. Anyway, so, oh my goodness. So that's a little bit depressing. My health isn't as good as it should be. But, when you've been overweight for as long as I have, which has been a good part of my life, I'm 42 years old, there's bound to be some negative side effects. So that's part of the reason why I got the surgery done. Good part of the reason why I got the surgery done, so I can eat better. And I have been. Let me tell you, it's been so amazing to just sit there and eat something and not be in pain. Okay, so getting back to the surgery, just questions people may have. I had 4 small incisions made. Of course, they do it with the little cameras, or keyhole surgery, or laparoscopically. So I had 4 incisions done. And it wasn't really painful. Like, I didn't really experience that much pain. Discomfort, yes. It's not like I felt like going for a jog, because it was kind of sore down there, but not really painful. The most painful thing was they had to put a stitch in my muscle because it was bleeding, something like that. That hurt because, when I moved around, that hurt. But I didn't find it so unbearable that I was taking pain medication. Like, I took Tylenol, but I wasn't taking... They sent me home with oxycodone, and I didn't really want to take that unless I thought I was going to die. So if it wasn't for that stitch in my muscle, like, the pain was pretty minimal. It was nice. So I had the operation Monday. I had to stay over until Tuesday. Oh, I was so bored. Oh, I was so bored. Because even though I was having trouble coming out of anesthetic and I was sleeping and a lot and things like that, by 10 o'clock at night, I was wide awake. I had slept all I needed to sleep and I was wide awake. And of course, Bruce had gone home because he had to be home for the kids. And so I'm just sitting there bored to tears. And also because they're giving you fluids and they want you to go to the bathroom a lot. I mean, that's one thing when they're first getting you up at an anesthetic, is that they want you to go to the bathroom to try to get things moving and flush out the drugs. That's my second complaint. I felt bad for the nurses constantly have to get up and, undo you from the monitors and oxygen and everything and take you to the bathroom. There was 2 nurses for like the 3 or 4 of us, which was really awesome. Very, very nice ladies. Very nice ladies. But the bed, when I had to get back up onto the bed, it was a little high. I'm kind of short. Okay, I'm not that short. I'm 5'2". But this bed was a little bit high. And so it was really kind of awkward and almost painful to get up onto this bed, this hospital bed. So that's my other complaint. I wish they would have had some sort of step stool or something like that, because that was really hard for me to get up and get comfortable again. And of course you have to go to the bathroom non-stop because you're getting fluids, so up and down, and I felt really bad for constantly bugging the nurses about that. Also, my recovery was a little bit rough because the night before the surgery I felt a little bit of a runny nose, and I'm like, oh, am I getting a cold? Okay, fine, it's not bad, it's just runny nose. Well, when I woke up from surgery on Monday, I had a horrible sore throat, and at first I thought, well, it's because I had surgery and my throat's dry. No, I had a wicked sore throat. I had a wicked cold for the next week. So that kind of really really sucked. But that's not part of the surgery. That's just unfortunate circumstances. But when I was, recovering from the surgery, sitting there in the clinic, I couldn't really drink too much. They didn't want me to really drink too much. So I was just sucking on ice cubes nonstop. I was told by Dr. Gagne that I could eat some solid food starting Wednesday because there was no incisions or anything like that in my stomach. But because I had such a bad sore throat and bad cold, I really didn't eat anything solid until about Friday. And the first thing I ate was fruit salad because that's what I've been missing is fruit. And I've been eating a lot of fruit since then. A lot of strawberries. It was a really weird sensation to actually put something solid and heavy in your mouth and to be able to chew and swallow it and not be in pain. Even though it's been 2 months, I'm still amazed that I can eat things and not be in pain. When Bruce took me out for my birthday, we went to this nice place for brunch, and they had this guy there slicing this roast beef, and I took a piece, and I haven't been able to eat roast beef in 5 years. And I took a piece and I remember sitting there eating it. And I was like, wow, I'm eating roast beef. Like, it was just such a nice feeling. So I forget what I've talked about right now. I'm kind of just going off the top of my head. So I've lost 12 pounds to try to get my health back on track. It could have been more, but it's part of me has been indulging a little bit on things that I haven't been able to eat in 5 years. Like the other day we were out to this Asian restaurant that we really like, and normally I just get the soup, and I'm like, I'm having Kung Pao chicken. I have not been able to eat Kung Pao chicken in 5 years. I'm getting that instead of the soup. So I ate the Kung Pao chicken and the mixed veggies, and I was able to eat the chunks of peppers and everything. I haven't been able to do that in 5 years. So I have been splurging a little bit, but I lost 12 pounds, but my eating habits have been getting better. It's been hard on me mentally as well because I like to eat as a coping strategy. And now that I've had this surgery and I've been told, you have this fatty liver, you need to lose weight. The fact that I can't use food as a coping mechanism anymore has been hard. I've been trying to do other things and it's stressful. But anybody who's gone through that, they know. I don't have to sit here and tell you all about it. I mean, Dr. Gagne in my follow-up appointment, he even confirmed yet again what many things have been said about this lap band, that it causes you to develop bad eating habits. So I hope this video, now that I'm feeling better and I'm feeling better physically and emotionally, I can get back to making videos on this channel of mine. I know it's very random when I make videos. I realize that. Like I said, for a person who has no life, I get crazy busy. Again, thank you everybody for your understanding and support through this whole process. If anybody has any questions about getting a lap band done or about anything that I've talked about, please, don't hesitate to ask. That's why I made these videos, to put these out here, to educate people, to help people. And yeah, so anyway, thank you everybody. I just heard a loud crash. I think my cats have done the Macarena in the kitchen and knocked a few things over. So, okay, I'll talk to you later. Bye.